All right, so the first video we're going to do here is going to be some accessory structures of the thoracic limb. As we look at the lateral aspect, we're going to start proximally and work our way distally. The first structure we're going to see here has this blue pin in it. That's going to be the lateral glenohumeral ligament. And if we flip this leg to the medial aspect, we can see that structure that purple pin is in right there, and that's going to be the medial glenohumeral ligament. As we look at the cranial aspect, we can see this thick piece of connective tissue, this thickening of fascia, and that's going to be the transverse humeral retinaculum that's going to be holding down and keeping the tendon of the biceps brachii muscle within the intertubercular groove. As we work our way distally down through the brachium to the elbow, we're now again looking at the lateral aspect of the elbow. We see these thickenings of connective tissue here that the red pins are in. That is going to be the lateral collateral ligament of the elbow. And if we flip medially, we see this structure here that the yellow pin is in, and that's going to be the medial collateral ligament of the elbow. We can also get a really nice view of the biceps brachii and brachialis muscles and find that their tendons are coming distally and inserting on this radial tuberosity. We see that biceps brachii tendon is kind of split, which allows that brachialis tendon to kind of come through a little tunnel, allowing both of those muscles to attach to the radial tuberosity. As we work distally down through the antebrachium, again, we're still looking medially, so we can see a really nice example of the pronator quadratus muscle in between the ulna and the radius. As we continue to work distally, now we're looking at the palmar aspect of the thoracic limb. Here we're at essentially what would be the metacarpophalangeal joint. And we can see this structure right here. If I open this up, we can see this structure that's now being held up by the probe. That is going to be the manica flexoria, that tunnel or collar that allows this tendon, the tendon of the deep digital flexor muscle, to pass through it. Just distal here, we can see another thickening of connective tissue. That's going to be the proximal digital annular ligament. And just distal to that is going to be the distal digital annular ligament.